Welcome to Mercy Medical Center's live webinar. I am Lynn Dennis, Program Coordinator, and today's topic is planning for your baby. Joining us is Michelle Altmeyer, Program Coordinator, and Amy Wright, Clinical Specialist at Mercy Birthplace. After their discussion, they will take questions from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow. Your questions will be confidential. Well, I'm very happy to welcome both of you to our webinar today, and we are going to begin with Amy, so I'll turn the headphones over to you now so we can go ahead and get started.
All right, thank you, Lynn. We are going to go ahead and get started with our webinar. Thank you for joining us today. Our objectives for today, we have several different things we're going to cover, and obviously we don't have a lot of time with an hour to cover every single aspect, but we're going to do as much as we can. Our different objectives today include the hospitalization options, prenatal care options, mental preparation, physical preparation, and financial preparation. It's really important for us at Mercy to recognize, and we feel that pregnancy and birth are just beautiful things, and each and every experience is unique. There isn't one of us that has a birth experience that mirrors somebody else, and that's the way that it should be. It should be all about you. Knowing what's important to you involving your health care, your birth, your baby is the first step in planning for the delivery of your baby. There are many hospitalization, prenatal care, mental and physical preparation, and financial options to make your experience enjoyable and to fit your individual needs. Our hope is to be able to address each of these objectives and to take questions you have and think of at the end of the webinar. So sit back, relax, and enjoy our webinar.
Okay, now we will review the importance of hospitalization options. When picking a hospital, know first and foremost what is important to you during your hospital stay. How many people may be in the room at the time of birth? Are there breastfeeding educators available? Can the baby go to the nursery at any time? What security is available? These are just a few questions that that may be helpful to you when choosing a hospital. When touring a hospital, it's a great idea. Touring is a great idea, of course, to decipher between your hospital options that you're curious about. Taking tours will help you compare what you do and what you don't prefer and which place fully suits your needs. Tours will help you figure out what the supplies and items that you do and don't need to bring during your hospital stay. Of course, there's personal tours available, and you can call and schedule an appointment or email for an appointment on the Mercy's website. Tours are a great way to actually see what your stay will look like. On the tour, you'll be able to see both a birth suite as well as tour our Level 2 NICU birth suites. While on the tour, classes and resources will also be discussed, along with all the recommendations and conveniences that Mercy does have to offer to make your stay comfortable and enjoyable. Also, websites may also have a virtual tour. Our virtual tour can be found on the Mercy's website. These videos will give you a good insight of what our birth suites look like and what you can expect to find in your room. Classes. We have many classes that are offered. Many classes, childbirth classes, are free. You can find a list of the classes online that fits your needs. There are also classes elsewhere in the community. Other hospitals in the corridor offer childbirth education classes. Horizon, Young Parents Network, Baby Birth and Beyond, Baby Time, and Lynn County Public Health are all examples of places that do offer childbirth education classes. NICU, it's important to know if your hospital does have a NICU, which is a neonatal intensive care unit. It's nice to know if the NICU is available to reinsure you in case that something would happen during delivery or your baby would need those services, and it is a rare occasion. Mercy has a Level 2 NICU, which means the baby can be delivered at 30 weeks and above, and it's embedded right here in the Mercy Birthplace. It's also important to know the visitation policy and safety that is available at the hospital. Knowing when and who is allowed to visit you while you're staying in the hospital is important. And different hospitals have different rules about visitation hours, and knowing those rules will be helpful in determining where you want to deliver. Mercy Birthplace lets anyone you want to come see you at any time, unless otherwise indicated, of course, by you to meet your needs. For the safety of your baby, every baby wears a hug security tag on their ankle, and that does sound an alarm if your baby were to get too close in contact with an exiting door. Also on tours at hospitals, a lot of times there is a gift that is given at the end of the tour, so that's a nice little incentive to go and tour a hospital.
Okay, and Michelle mentioned the hug tags, and you'll see on the screen a picture of twins that we actually had in our NICU a couple months ago, and you'll see on the bottom of the baby on the right-hand side has a little hug tag on, and that's what it is. It goes right on the bottom of the ankle, is securely strapped, and it will protect the baby from the moment that it's put on until the moment we discharge it and cut it off. And we actually check that system. I personally check it monthly. So moving on to prenatal care, this is one of the first things that you need to think about once you find out that you're pregnant. You need to decide where you're going to go, because it's very important to take care of not only yourself, but take care of your baby. Regular prenatal care increases the likelihood of a healthy pregnancy and birth, and prenatal care decisions that you'll be making include choosing a provider. Your prenatal checkups, you'll have your initial visit, your second trimester appointments, your third trimester appointments, and then also nutrition and wellness information. At your first prenatal appointment, once you've chosen your provider, and I should mention too that you need to pick a provider that best fits you. Is it going to be an OB/GYN, a family practice doctor, or a certified nurse midwife? You need to decide what is best for you and what fits your needs and what you and your significant other feel would benefit you throughout the next 40 weeks. Your initial visit will occur between 8 and 12 weeks, and this is where they'll review and update your medical history. They'll review any behavioral, lifestyle, and social issues you may or may not have. You'll have a physical exam, view different logistical issues, and then have screening and testing done. It's always good to go prepared to this visit, making sure you have a current list of medications and any questions you might have, and also know what your family history is. You know, is there a history of cancer, is there a history of diabetes, different things like that that can help your healthcare practitioner hone in on any difficulties you might have during your pregnancy and how to map out the rest of your pregnancy for you. They do all kinds of screening and testing while you're there. They'll do a blood type and Rh factor, a complete blood count, antibody screening, HIV, rubella, and chickenpox immunity, and other different things as well. You also can, at this point, at your initial visit, indicate whether or not you want the early testing for Down syndrome, which is just something they do around 12 weeks of blood tests and an ultrasound. And then it moves into the early second trimester. Once you get 14, 16 weeks along, you're feeling a little bit better, and you start to do some different testing then. You'll have an actual visit. Sometimes you just have a nurse practitioner or a nurse visit at the 8 to 12 week, and then you'll see a doctor actually at the 12, 14, or 16 week visit. And this is where they'll start to pay attention to your weight, make sure you're not gaining too much too quickly, look at your blood pressure, and try to take a listen to your baby's heart tones. It's not always possible at 12 or 14 weeks, but some babies do cooperate and let you hear them. Then your late second trimester, or 24 to 28 weeks, and you can't forget at about 20 weeks you'll have that phenomenal ultrasound where you'll get to see your baby, and they'll check well-being, check different structures, check for organ functionality, check for growth, and then if your baby cooperates, you'll also get to see if it's a boy or girl if you want to, or you can make it be a surprise, which is also fabulous for those of us who are labor nurses to get to have that be a part of that. During this trimester, like I said, they're going to really pay attention to your blood pressure and your weights. Then we move into the late second trimester, 24 to 28 weeks. They'll continue to be recording your weights, your blood pressure. You'll definitely be hearing your baby by then, and probably feeling your baby by then. And they'll also measure the fundal height, which is the size of your uterus, to see what your length is. It kind of helps correlate to how many weeks you are. And if it's not correlating to the number of weeks, then the doctor may do some further testing from there. Like I said, you'll have an ultrasound done at the 18 to 22 week mark, and they'll also do some different screening and testing between 24 and 28 weeks. They'll also do a blood count to make sure you're not anemic, and then also do the glucose tolerance test, which is absolutely fabulous. I've had 5 kids. I've done it 5 times, and every time I've dreaded it. But it's fabulous orange cola you get to drink, so something to look forward to. And then your third trimester comes, you're starting to feel a little bit bigger, a little bit more tired. You're going to start seeing your doctor every 2 weeks if everything is going well. This will be at 32, 34, 36, 38, and then 40. Sometimes at 39 weeks, they'll go ahead and start seeing you weekly at like 38, 39, and 40 weeks. Just kind of depends on how your pregnancy is going. Do you have any other risk factors? Are you diabetic? What's your age? Things like that. So, and this is something your doctor will map out with you during your first screening, your first doctor's appointments. And nutrition and wellness is something that you need to keep in mind, because even though you're pregnant, you're eating for two, but that's not an excuse to overeat. You need to make sure that you're getting all your calcium, protein, iron, folic acid in. Folic acid is very important to be maintaining throughout your pregnancy and before. If you're thinking about getting pregnant, start to up that folic acid if you can. You only need about 300 more calories a day from healthy foods. That doesn't mean you need to get 300 from McDonald's every day. You need to get 300 from your fruits and vegetables and greens and that sort of thing. You need to make sure you're drinking plenty of water. They'll say make sure you're drinking plenty of fluids, and things that do not really constitute healthy fluids include like juice and pop. Pop can actually dehydrate you, which cannot be a healthy thing for someone that's pregnant. So make sure you're drinking lots of water while you're pregnant and even before pregnancy. There's different things that you can do for counseling, nutritional, and medical resources that you can do for women's wellness. There's prenatal yoga that you can take, and I know Mercy just started offering that as well. It's a phenomenal class to help you stretching and to help you feel a little bit better. It focuses on the challenges and changes during pregnancy by focusing on the areas that need stretching and strengthening. There's nutritional counseling for pregnant moms that you can do, and then also back pain services. An important thing to mention too is here when you, and I know Michelle will mention classes here shortly, but one thing too is get your parents, get your grandparents, aunts, uncles, siblings involved, because the education that was taught years ago, it's all changed within the last couple of years, and so it's always good to get your elders involved so that they kind of know what you're going through as well.
Okay, now let's talk about being mentally prepared for having a baby. There's many ways to prepare yourself mentally for having your baby, whether it be talking to friends and family for advice and support, or by checking out books at the library. By finding answers to the questions and the concerns that you may have, you will be prepared and ready for the events that are soon to happen during your pregnancy and birth. A few suggestions might be talking to other parents. Who do you know that's just had a baby and has gone through this? Might be very helpful to you. Of course, finding information online. These days there is a lot of information on the World Wide Web that can be found. Going to your local library, your local bookstore, checking out any type of books is a great resource as well. And reading handout and materials such as booklets, brochures, and packets from your clinic visits, from hospitals, or other places here in the community. And of course, taking a class or joining a group is important and will help you mentally prepare. The more you know, the more prepared you will be. All right, classes and education. Of course, there are many classes offered here in our community. There's a lot of different educational opportunities, and other hospitals in the corridor offer classes as well for new and expecting parents. There are classes, like I just said, at other hospitals here in the corridor: Horizons, Young Parents Network, Birth, Baby, and Beyond, Baby Time, and Lynn County Public Health are examples, and of course, as well as right here at Mercy Medical Center's Birthplace. The classes that we offer here at Mercy Birthplace, is the Childbirth Education class. This class covers preparation and strategies for labor and delivery, breathing and relaxation, comfort measures, postpartum care, baby care, and child safety and parenting. A lot in that class. Another class is the prenatal breastfeeding class. This class is for women who are thinking about breastfeeding. Of course, you can learn the benefits and dynamics of breastfeeding, and dads are welcomed at that class as well. Another class, or actually just services that we offer, is our breastfeeding education and services. Our international board-certified lactation consultants, which offer visits before you deliver, during your stay here at Mercy, and we also have a free home visit program after you're discharged. And these visits will help you answer any questions or concerns that you may have with breastfeeding, and also teach you effective breastfeeding strategies. Another class that is actually new here at Mercy is our here we go again. It's our childbirth refresher class. It's a shorter class than our childbirth education class, and this class reviews the normal signs and symptoms in the third trimester, stages of labor, birthing process, relaxation, and breathing techniques, and postpartum and baby care. We've also added a new class called If Breathing Isn't Enough. It's a medicated birth option class. And this class covers the benefits and risks of epidurals and medicated pain relief during labor and birth. And a sibling class is another class. Let your other children in on the excitement of this big event. And of course, we have age-appropriate activities. It's for 1 hour. It's a monthly class on a Saturday. And the big brothers and big sisters do get to make a gift during that class for their new sibling, which is a lot of fun at sibling class. Amy also did mention that we have started prenatal yoga here at Mercy. And that is on Wednesday nights, and we do actually charge for that class. Otherwise, all the other classes are free. And all of our classes, I should mention, are on our website at mercycare.org.
Okay, so we've discussed a little bit of the things we can do, but there's a lot of physical things that you need to do as well. You need to start thinking now about how are you going to keep your baby safe once it comes home from the hospital. Obviously, we all wish that we could take a nurse home with us once we go home, but obviously we can't. And so you need to start putting the things in place now to be able to prevent any injuries and accidents that could occur. One of the first things that we want to talk about is car seat safety, because this is big. Car seats are all over the place. You don't know what kind to get. You don't know if you get a used one. Can you get one that's on clearance, and that sort of thing. So there's different things that you need to go to look at when you go to look at a car seat. According to the CDC, the Centers for Disease Control, the usage of car seats reduced the risk of death in passenger cars and infants by 71%, which is huge. That's a big number. But this isn't going to happen unless you're using the right car seat and using it correctly. You need to know how reliable your car seat is, especially if it is a used one. You need to check the manufacturer date and the model number. Never use the car seat if it's been recalled. Make sure the car seat is not over 6 years old. Make sure the car seat isn't missing any parts or damaged in any way. Don't use the car seat if it's been a moderate or severe car accident. And if you don't know the history of the car seat, then you shouldn't use it. It's not a good idea to buy one at a garage sale, not a good idea to buy one off of eBay or anything like that, because you don't know the history. You should remember that a car seat should always be rear-facing, and the American Academy of Pediatrics actually released a statement 2 years ago that recommends that the infants be backward-facing until they're 2 years of age and until they reach the highest height and weight allowance on the car seat. So they need to stay facing backwards until then. Your car seat should always be in the second row of the car and in the middle seat if possible, and always away from all airbags within the vehicle. And you can get your car seat checked at the fire station and police department. I also found when I was researching for this webinar that there is a car seat app that you can purchase on iTunes for $1.99. It'll help you figure out whether or not your car seat is applied correctly. A startling statistic I found is that 4 out of 5 car seats are installed incorrectly. So there is cause for need to do that, and 42% of unintentional childhood deaths are due to car crashes. So you need to make sure that not only you're driving safe, but that your car seat is installed correctly in your vehicle.
Thank you, Amy. I will also mention I am part of the Linn County Safe Kids Coalition here in the corridor, and it is true that 80% of all car seats are installed wrong, and we don't want you to be in 80%. So there are some free services around Linn County here. I'll tell you that the second Thursday of every month from 5:15 to 7 at McGrath GMC in Hiawatha, we do have a certified car seat technician that does go and volunteer and can check out your car seat. That's the second Thursday of every month from 5:15 to 7. We also just planned a new event, which will be taking place on Saturday, August 3rd at Bob Mickey Collision Center on Centerpoint Road, and that's from 9 to noon. That's August 3rd, and we will have several certified car seat technicians out there to check out those car seats.
Okay, so now you know how to make your car safe, so let's look at making your house safe. You need to remember that nothing is ever 100% child-proof. You're always going to have little bits and pieces of this and that come around that you didn't think about. I know from my own experience, one thing I didn't think about were plants. I had a plant very close to the ground. My son grabbed a leaf off of it and started choking because he put it in his mouth. So you're never ever going to be 100% child-proof in your home, no matter what precautions you take. But now is the time to start making those precautions so that you're not running into things like I did with a leaf in your child's mouth. So there's different products out there that can reduce accidents and injuries for your infants. The first one is smoke detectors. It's recommended that smoke detectors are placed on all levels of your home and outside every bedroom to prevent injury and death from a possible fire in your home. They should be checked at least once a month, and also new batteries at least once a year. I know in my house we have a standard rule that every time the season changes or the time changes, we change the batteries in the smoke detectors. So that's a good way to remember to do it. Carbon monoxide detectors are also invaluable in your house. They should be placed near bedrooms or sleeping areas in your home. It is most important to have them if your home has gas or oil heating systems, or if you have an attached garage, as those can be sources for carbon monoxide exposure. And you also need to make sure that you're changing any batteries or different detectors within the detector as well on a timely basis. Safety latches and locks, you'll see these at every store that you go into. You can purchase them. They can be used on cupboards, cabinets, and drawers, especially those that are like in your bathroom and kitchen. And by using them, you can prevent your child from getting into harmful chemicals, cleaners, medications, and other things that can cause poisoning and injury. Safety locks and latches can also prevent hand and finger pinching. And one thing that they've also come out with that's fabulous are toilet lid and refrigerator door latches. And those are also important to think about when you have a little one that starts to be on the move. Safety gates are something that a lot of parents use. They're important in keeping children away from stairs and other areas you don't want them to have access to. They're used to prevent falls and stairwell-related injuries. New safety gates have a certification seal from the Juvenile Products Manufacturers Association that lets you know that they meet all current safety standards. Door and doorknob covers are also fabulous to keep and a great way to keep your infant out of unattended rooms or doors with possible dangers in them, such as a swimming pool or tools. Doorknob covers should be strong enough to not break if an infant tugs on it, but easy enough for an adult to open in case of an emergency. By locking your doors and using doorknob covers, you can prevent many kinds of potential injuries and accidents for your infants. Window and blinds safety. Using safety netting or window guards can be a very effective way to prevent injuries or serious falls from windows, balconies, and decks. It's important to remember that window screens are not effective in preventing children and infants from falling out of windows or through doors, so window guards and safety netting is important. Blinds can also be a hazard to your infant, like the blinds that are on your windows. Make sure that all blind cords are cut and the inner stops and safety tassels are secure at the bottom of the cord to prevent strangulation in the loops of the cords. And there are different blinds now. They're cordless, and those are also a fabulous option to use. And then finally, outlet covers. These are a great way to prevent electrical shock and electrocution. They should fit tightly in the outlet and should not be removed by infants and children.
Okay, it is also important in preparing your home to make sure that you practice safe sleep, and I'll talk a little bit about the crib and sleep safety. So sudden infant death syndrome, also known as SIDS. SIDS is the most common cause of death in infants 1 to 12 months old. Using crib and safe sleep reduces the chances of your baby dying, of course, from sudden infant death syndrome. And we cannot stress this enough here at Mercy. This past fall, there was a group formed. The Linn County Safe Sleep Task Force was formed just looking at infant deaths. In the state of Iowa, 87 babies died because of unsafe sleep practices. So we've really focused on this here in Iowa, and in Linn County, certainly Linn County actually has the highest percentage of infant death rates due to unsafe sleep practices. So it's important to remember the ABCs of safe sleep. Your infant should always sleep alone. Your infant should always sleep on their back, and your infant should always sleep in their crib. No exceptions. ABC, alone, on their backs, and in their cribs. The crib should look pretty bare. We always say decorate the room and not the crib. So your crib should only have a tight fitted sheet in the crib. No blankets, no pillows, no toys, no more bumper pads. In fact, recently the state of Maryland is the first state in the country that has passed a law where no bumpers can be sold at any retailers. And we hope to become the second state in the country, but that has not yet happened. So, so once again, we cannot stress this enough. And of course, a smoke-free environment. Both hospitals have come together, and all of our babies actually here in the corridor are all swaddled, newborns when they're born in Halo sleep sacks. So the American Academy of Pediatrics has recommended that infants for their first year be sleeping in sleep sacks. That helps, of course, reduce on the chance of them suffocating on a blanket. And while your baby is born at either hospital here in the corridor, we do use the swaddle sleep sacks. ABCs, alone on their backs and in their cribs. Can't stress that enough. Okay, now it's time to think about the finances. So when preparing for a baby, of course, there will some things financially that you will need to be prepared for. Like I said, of course, there's many finances that come along with your new baby that you may not have thought of. Being financially prepared can eliminate a lot of stress and financial concerns that may just pop up. So here's some tips that might be helpful in preparing financially for your new bundle of joy. Research what your insurance company does and does not pay for regarding pregnancy, delivery, breast pump, and of course your hospital stay. You might want to figure out the expenses that are left over from insurance that you will have to be able to pay. Figure out pregnancy, baby leave, maternity leave, and how that will affect your finances. Taking possibly a Financing 101 class might be an option. These classes certainly can help with budgeting and controlling and monitoring your expenses. So it's never too early to start budgeting.
So within that budget, there's a lot of different things you need to consider when it comes to your finances. You're going to have not only one-time costs, but you're going to have ongoing costs that you need to think about. And the sooner you start budgeting for it, the better. You need to start thinking about how much are you going to spend on diapers, baby wipes, feeding necessities, and things like that. One-time costs include things like a diaper bag, a stroller, car seats. You buy the infant car seat that goes up to 20 pounds, but then you'll need to get a different car seat from the time they're 20 pounds until they're bigger and over the age of 2. A crib and crib mattress, changing table, basic bedding, high chair, and a baby bath are just some of your one-time costs. Your ongoing or continuous costs include things like daycare, diapers, baby wipes, formula, bottles, and nipples if you choose to bottle feed, baby bath soap and lotion, clothes, burp rags, towels, toys, always the important thing with toys, and different medications and first aid products. By knowing the basic costs for these things, set a budget each week or month to make sure your ends meet and your family and your baby has everything it needs. Look around for best prices on products of your choice by shopping around, and don't forget that there's always online resources such as like Amazon.com has a lot of good prices on different things like diapers and wipes, so make sure you're using the web as well. And there is a calculator on BabyCenter.com that can help you calculate monthly and yearly expenses. And you also need to think as well as as far as ongoing costs, is what if there's a complication with your delivery and you need to stay off longer than you anticipated. Having kind of a slush fund or a cushion there in case you do have to be off extra time is always helpful to figure in, as well as what if your baby, in the rare instance, it needed to go to the NICU and so then you need more time off because the baby hasn't come home yet. That's also something else you need to keep in mind. A couple of things that I jotted down just from my own experiences is know what your short-term disability is and also your FMLA requirements. For example, do you need to take paid leave to meet your requirements for short-term disability? How much do you need to take? And do you have the short-term and long-term disability plan in place from your employer? And it's never too early to start planning for college. There is a great thing the state of Iowa has, a 529, I believe is what it's called, fund that you can get set up and you can start putting money into your college fund for your child. And it also has great perks where you can sign up for, like if you go shopping different places, there's a little like keychain tag that they can scan, and then there's a certain percentage of your Like if you go grocery shopping, there's a certain percentage from your groceries that will go into the college fund. So investigate those different things and start getting those in place now, because even if you're not pregnant, it's never too early to start planning those different things.
Well, thank you both for helpful information. And I do want to point out the 529 College Fund can be opened by grandparents also. It's not just speaking as a grandparent. That is possible to do that also. So to remind you, our questions can be submitted from the box in the upper right-hand corner of your screen. You just click on the orange box and type in your questions. Okay, first question, if the first appointment isn't scheduled until 8 to 12 weeks, what do you recommend as the best place to go for good prenatal care guidelines? I know you mentioned several on your slide, but is there, any one or two that you really recommend?
There's really not a hard set answer to that question, but I would recommend if you've decided where you're going to go, if you have questions, you can always call and just speak to your physician's nurse, the physician that you're planning on, their nurse, and just say, I have a question for the nurse, and what should I do? There's fabulous resources out there, like what to expect when you're expecting, and that sort of thing. Mercy, when you go to that first appointment, Mercy always gives you some information as well to take home with you that has more things. But don't be afraid to call, your physician's office, get different resources by doing research and getting evidence-based facts. And then the birthplace is always open. We're open 24/7. So even if you're just a couple weeks along, 6 to 8 weeks, you can always give us a call and we can give you advice for questions you have.
Next question came in. Does Mercy have a NICU? Who wants to take this question?
Yes, good question. Absolutely, Mercy does have a NICU, our Neonatal Intensive Care Unit. We here at Mercy are a level 2 NICU. Dr. Allen is our staff neonatologist, which it is rare that a level 2 does have a neonatologist on staff. And he is comfortable in taking care of babies 30 weeks and greater. We do have a partnership with the University of Iowa Children's Hospital, which is the only level 3 NICU in the state, which does take care of the sickest babies. And like I said, it is the only level 3 NICU, and he does work closely with them. But yes, Mercy does have a NICU. In fact, we have the corridor's only private NICU suites. Yep, they're nice big suites where, of course, we encourage as parents to stay with the baby if it is an occasion where your baby does need extra care after birth. I hope that answers your question out there.
And just to add on to what Michelle was saying, we actually, in the NICU, if a baby has to go to the NICU, and one big concern is, am I going to be separated from my baby? And we make all accommodations possible so that you can stay as close to your baby as needed. That way, even if it's where you want to stay in the room, as long as your baby is able to tolerate that, Dr. Allen has no problems with the mom staying in the room, and the nurses will come to you. We've even moved a patient bed into the NICU to be able to take care of the mom and baby together in the same room.
Another question, does your hospital store have breast pumps? Any certain brands in particular?
Yes, that's another great question out there. Yes, absolutely. Our Mercy Medical Center home medical supply store, yes, we do have breast pumps. We have both models. We have the Ameda and the Medela. So typically what happens is your physician can write a prescription and the breast pump can be delivered straight up to the room. It is one less thing to have to do. And it is good to possibly check out to see if your insurance company does pay for a breast pump. But yes, the Mercy Medical Center does have both the Medela and the Ameda, which are both great breast pumps.
All right, very good. Next question, when is the best time to take a tour during the pregnancy? And I think Michelle is going to take this one.
Yeah, that's another great question. You know, we welcome everybody, even if you're not pregnant. Come tour, come see what we have to offer. So, you know, it is really up to anybody when they want to come tour. We see people that just find out that they're pregnant, they're very excited, and they want to come and tour, and absolutely. Or we even see, I actually just toured somebody yesterday that's due on Monday. So some people just, you know, it's really, you're welcome to come and tour, at least here at Mercy, at any time. Yes.
All right. When and how often should an ultrasound be scheduled? I know you talked about when the first one would be, but beyond that, who wants to take this question? Looks like Amy might take it.
Okay, well, I mentioned earlier that if you choose to do the extra testing to see if there's any risk for Down syndrome, they will do an early ultrasound at like 12 or 13 weeks, and then again, your doctor will schedule one at approximately 20 weeks, give or take a week or two. The thing about your due date is it can be plus or minus 2 weeks, so if they think that you might be off on when your last menstrual period is, they might schedule one in between there just to see what's going on. And then after that, it just kind of depends on, you know, if you're considered advanced maternal age, which is any mom over the age of 35, they might schedule more frequent ones. If they think there's a congenital anomaly or something different in the baby, they would do one differently. But most insurance companies will only pay for one ultrasound, two if you choose to do the Down syndrome testing.
Okay, we're going to switch gears a little bit here with the next question. I just bought a car seat at a garage sale. Looks brand new. Is this one safe to use?
Good question. Car seats at garage sales. We do not recommend purchasing a car seat at a garage sale because you do not know the history of that car seat. You know, if Amy did mention that if the car seat has been in any type of accident, minor or severe, certainly it's considered expired and is not recommended to use that. Even if but you know, you're buying the car seat at the garage sale and they do tell you the history of the car seat, that's just something that we still would not recommend. Here in town, the Lynn County Safe Kids Coalition, we actually have a car seat loaner program, and your hospital will know if you're unable to get a car seat or something. There are other services out there here in the community, but we do not recommend purchasing a car seat at a garage sale.
Now, on the same topic, could you repeat the rear-facing car seat guidelines? And I think Amy's going to take this one.
Sure. In the statement, according to the American Academy of Pediatrics, they should remain rear-facing until they're 2 years of age and until they reach the highest weight and height allowed by the car seat. So, for example, if it says they need to weigh 35 pounds and be, I don't know, 34 inches tall, I don't even know a proper height for a 2-year-old, but you would want to keep them rear-facing in that car seat until they're 34 pounds and 35 inches or whatever it is. But so that's what the American Academy of Pediatrics has recommended. And if you want to see this, if you go to even babycenter.com has these recommendations, or you can Google American Academy of Pediatrics and car seat safety, and it'll come up with a statement for you.
Okay, the next question is asking us to repeat the information about the college savings plans where buying groceries and so on will contribute to that savings plan. Amy, have that?
Yeah, that's a great question. Like I said, it's never too early. But if you just go to Iowa 529 plan, it'll take you to the state of Iowa. It is a thing that the state of Iowa has started. So if you just go IA 529, it should bring it up. If you just Google that, it'll bring it up for you, and it'll tell you all about how to get it set up. I know my husband and I worked with our financial advisor. He helped us set it up, and then we were able to just contribute with our groceries and Target and everything like that, but then we were also able to give the website to grandparents so then they could put money in, like birthday money, baptism money, and things like that, and then also had the keychain swiper type card that they can scan at the different stores and money goes into it.
Okay, never too early to begin making those plans, that's for sure. Here's another question from a grandmother. I saved the crib I used for my children. Can I use it when my grandchildren spend the night?
Unfortunately, no. I feel so bad saying that because I'm sure it's probably a car seat that, or excuse me, a crib that your own children were in it. But no, safety regulations have changed, and you need to pay close attention to how far apart the bars are on the crib, how low it goes or doesn't go. And a lot of the older cribs had the side that would lower up and down, and those are illegal. You cannot have a crib like that. They're highly prohibited. And I know we talked about buying car seats that are used. Well, buying cribs that are used are also kind of along the same way, just because you don't know what was done to it. Was it modified? Was it not? And you absolutely cannot buy a I keep saying car seat. You cannot buy a crib that has the side that goes up and down.
I just want to point out that if anyone has additional questions after the end of our webinar, your questions can be directed to the telephone number on the screen, 319-398-6350. Also, additional information can be found at the Mercy Birthplace website, which is mercycare.org/birthplace. Okay, I have another question. How do parents get a birth certificate for their baby? And this is going to be Amy's answer.
Okay, well, it's really simple. We have a form that you will fill out while you're here in the hospital that says what you're going to name your baby, and then we fill out the rest of it that says like birth date, time, who delivered the baby, different things about the mom's prenatal history, and then we collect a fee of $35 that's made out to the Iowa Public Health Department, I believe. It has to be a check or cash. You cannot do credit card or anything like that. And we collect that, we send it into the state, and then they will mail you the birth certificate within 6 to 8 weeks.
Okay, I want to mention our next webinar topic is very close related to this. We have a kind of a Parenting 101 series going on here, but the topic in August is breastfeeding support close to mothers in honor of World Breastfeeding Week 2013. The presenters will be 2 certified lactation consultants, Linda Klein, who is the director of Birthplace, the NICU, and pediatrics, and Lynn Devine, a certified nurse in Birthplace. It will be broadcast Thursday, August 8th from noon to 1, and they will take your questions live after the discussion also. Now, a tape of today's program will be available at the website on the bottom of your screen that's up right now, mercycare.org/live, possibly by the end of the day today. And if you didn't get a chance to listen, or if you'd like to refer back or tell a friend about it. You can always check this website for information about future webinars and listen to past webinars as well. Now, if you're interested in future webinars or events from Mercy, you can sign up for Mercy's electronic newsletter, and that's available at mercycare.org/e-news. Now, before we close up, we're going to check to see if there's additional questions. And I wondered if either one of you could talk about, I've heard it on the radio a lot, the world's largest baby shower. I really don't know what is involved with that, but I know something's going on soon.
Sure. Our friends at Cumulus Media have put together the 2nd annual World's Largest Baby Shower right here in Cedar Rapids, Iowa. And that's actually taking place this Saturday, July 13th, and it's from 11 to 3 at Hawkeye Downs. And I believe there is a $2 admission fee, but there are many vendors there. Both hospitals will be there. Of course, Mercy will be there, and there'll be a lot of free stuff that you can register for to win, or I should say door prizes. There is a $1,500 gift certificate from Toys R Us, and Mercy, we have several items that we will be giving away. So we hope that you come see our booth this Saturday at the World's Largest Baby Shower right here in Cedar Rapids, Iowa, Hawkeye Downs from 11 to 3.
Very good. I'm glad we had a chance to plug that activity. Okay, I think we have covered all the questions submitted to us. But again, if you have additional concerns or questions, please give either Amy or Michelle can be reached at the number on your screen. Well, thank you all for joining us today.